This is Dr. Greg Hall once again with Better Black Health, brought to you by the Better Black Health book, which is on sale at Amazon and all of your favorite bookstores, as well as Genetic Sequence multivitamins, finally back and in full stock, right? And so people are still loving them despite the break in our supply that happened at the end of the year. Today, we're welcoming Dr. Byron G. Jackson, a chiropractor and leader in clinical biomechanics and integrative wellness, affectionately called the Good Doctor, like the TV show, right? He's a clinical director of A Chiropractic Healing, one of the top 50 practices in Northeast Ohio, and the author of 6 books, including 100 Health Secrets, which I just need like 10 of those, as well as You Should Prosper, which I need that book too. Dr. Jackson has a Master of Science in Health, Sports Health Science, and a certificate in Physiological Therapeutics. He's also a wellness consultant and advocates for a healthcare model where medicine acts as a firefighter to save lives, and chiropractors serve as the contractors to rebuild functionality. Isn't that great? Dedicated to de-stigmatizing the field, Dr. Jackson demonstrates that chiropractic is not about belief, but it's an objective science essential for empowering others. Welcome, Dr. Byron Jackson.
Thank you for having me, Dr. Hall. Thank you.
No, I'm really, really happy. I send patients to you, and so we've never had a chiropractor on the show, and let's be real. There's people that love chiropractors, and then there's certain professionals that pretend you don't exist. Isn't that true?
Amen to that. Unfortunately, that is the thing. But I think that the biggest misconception is we use this word alternative, right? And even patients that come in to see me, right? I tell them chiropractic care is not an alternative to medicine. And I try to explain to people, one, medicine is managing your crisis, whereas chiropractors, we're essentially managing the architecture, right? And until we can really understand that, the healthcare system will forever be broken. And that's the unfortunate part. Now, yeah, there's some bad apples with any profession, right?
Oh my goodness,
yeah, right. And I tell people all the time, I say, hey, listen, just because I had a bad, I'm bald now, but just because I got a bad haircut when I was getting my haircut,
right.
doesn't mean I hate all barbers.
Right. And it doesn't make sense. And the same thing happens in my field. I mean, there are people that say, I hate doctors. Well, you shouldn't hate doctors. You hate the ones you've met so far, but you can't. And then I have them say, except you, right? So I hate all doctors except Dr. Greg Hall. I'm like, that's crazy too. But it's true. Everyone brings something to the table, right? And I have been, as a patient, I went to a chiropractor before I was a physician over 40 years ago. I mean, my father said, your back hurt, you need to go to the chiropractor. And that was what the thing was. And it wasn't like you don't need to go to the doctor. You need to go. It's like, based on what I'm hearing is going on with you, you need a chiropractor. People have car accidents. Well, actually, don't let me do it. Tell me, when should someone think that they need to go to the chiropractor?
So very good question. I think the best way to really explain it is what I like to call the firefighter analogy. Okay. So, Doc, if a person's house is on fire, the first person they should call is not their mom, not their dad, not their pastor. And I'm a spiritual guy, but the first person you should call is 911. As for the firefighter, right? Now, the firefighters are going to come in, they're going to hose your house down, right? They may even destroy some of your valuables, but at the end of the day, they save your life. Most important thing.
Right.
Now, a month later, when it's time to rebuild the house, if you picked up the phone and called 911,
yeah,
they would think you were ludicrous.
Yeah, right.
Right? Yeah. They think you're lunatic, right? And so I try to explain to people, so when you go to rebuild the house, you're not calling 911 again. Now it's time to call a contractor, right? That's going to put together engineers and architectures and landscapers. And now they're going to rebuild from the bottom up. And I try to explain to people, I know that's a pretty jovial expression, but I try to explain to people, think of, in general terms, chiropractic and medicine like that. Think of medicine as the firefighter. When you're in a crisis, when something is going on, right? You go to your MD, your DO, you find out what's going on.
Right.
Now, once you're out of the fire and you're talking about rebuilding and what can I do, what stretches will maintain, or what foods can I eat to help me stay more optimal, that's what chiropractors do. Essentially, we're helping coach people to an overall healthier lifestyle once the fire has been put out by you.
Yeah, no, I think it's so so important because the people have misconceptions about a lot of things, which is why a show like this is important because we can kind of say, well, you thought this, but in reality, it's really something else, and they're not trying to move in, and they're not trying to get you to stop going to doctors, and doctors should not be trying to get you from going to chiropractors. We need to work together. They
With
just say if
me,
they want to take an alternative medicine, or if you want to go to a masseuse, great, whatever works. We should be working together. We should not be poo pooing each other, right?
and that's why I say, me personally, I don't like the word alternative, because to me, alternative means that you have two options for the same thing.
Hmm.
And so, like for example, it's like saying I'm going to go to a dentist instead of an orthodontist,
Right,
right?
right, right,
They
right,
they're both in the dentistry field,
right.
but they do two different things.
Absolutely. Well, that's the same thing for my patients to say, don't you have a natural treatment? And I'm like, well, all treatments come from nature. All treatments come from this earth. Amlodipine is essentially a chemical that was made on this earth. It's natural, right? Low, all the cholesterol lowering medicine. So when you say you want something, you can kill yourself with an overdose of vitamin C,
Hmm.
just like you can kill yourself with an overdose of amlodipine. And people will say, well, what's the side effects of losartan? Well, what's the side effects of vitamin C? You take too much, you can get diarrhea, you get itch. There are side effects because they are all chemicals. And so, like you say, the alternative or the so-called natural approach, everything I do is natural, and everything you do is natural. It's just that what you need, what you have to do is you're in terms of trying to rebuild some of the stuff that we don't rebuild. So, like, give me some examples of something like, I'm going to throw a muscle relaxant at them and
Hmm.
maybe a steroid pack, and then I'm walking away, right? But
All right.
what are you going to do then?
Yeah. So very good question, and I deal with this all the time, right? Classic example, I can tell you, even like something similar as this morning, right? Person comes in, acute low back, and
Mhm.
the first thing is always, well, what happened? Well, nothing happened, doc. Okay, well now I got to become a detective, right?
Right. Something happened, right?
Right,
Right,
right. Well, how long has it been bothering you? Well, it started about 2 weeks ago. Okay, well, were you shoveling? Oh, yeah. Well, we had the snowstorm and the ice. Okay, now we're getting somewhere, right?
right,
All right.
right.
All right. So, they got the classic sciatic pain coming up the low back, going down the legs, right? And so sometimes patients are so symptomatic, right?
Mhm.
They're in that fire. They're so symptomatic. I
Right,
literally will write them an order or referral to go up the street to, if they don't have a primary nearby, to go up the street to urgent care to get a Toradol shot, right?
right, right,
Right? Because we got to get the inflammation down. We got to get all of that extraness out of there, right?
right,
So
right.
once they've gotten out of that fire state, then they'll come into me. And so there's a number of things we'll do, right? So we may do some therapeutic modalities, right? We may use ice, heat. We may do some electric stimulation,
Mhm,
turn down the pain symptoms, right? Reduce some inflammation. Sometimes we do ultrasound.
mhm,
Then, from a chiropractic perspective, what we do is we take the joints that are misaligned and very, very gently, click by click, try to realign or take the pressure off of what people will call a pinched nerve so
mhm,
that they therefore feel better. Then, once I've got them to a more stable position, then we'll do some therapeutic exercises or therapeutic activities, depending on their job, right? So,
mhm.
therefore, we can then try to restructure and reframe all of the tissue around it to help the framework stay in position a little bit longer.
Yeah. Well, let me ask you a quick question. How do you know whether to put ice or heat on something? If something's wrong, do I? It's like a 50-50 chance, right? But do I leave it alone? There's probably three choices: leave it alone, put ice, or put heat. How do you know which to choose?
Yes.
In general, I know it's all particular, but in
Yeah,
general.
yeah, yeah. So very good question. I'm going to speak with you as if I'm talking to one of the athletes from one of the professional teams we have here.
Mm-hmm.
I always tell them never put heat on a joint,
Mm-hmm.
right? And I say, hey, if you're playing basketball and you're one of the Cavs players and you sprain your ankle, you wouldn't put heat on a swollen joint, right? Why? Because it's going to bring more blood
Mm-hmm.
there to the area, which can leave inflammation and start to break down the joint a little bit more. So I
Mm-hmm.
always tell patients, in general terms, put ice on a joint, anything that bends, right? And
Mm-hmm.
then on muscles, on the tissue, the meaty part of the body, like to use heat.
Okay, we like you. And what's the rationale behind it?
So I'm using the heat, especially in the office before I make an adjustment, is because I want to relax the tissue, right? I want to bring some blood to the area, flush out some of the toxins, and
Mm-hmm.
then make an adjustment that way.
So when do you do nothing? Like don't put ice or heat on something. Is there are there cases where you think about that? I mean, just asking.
Yeah. No, so very good question. So in chiropractic care, we have essentially two different type of patients.
Mm-hmm.
We have what we call one a palliative care, which essentially when it's not bad, but patients are treating me more or less like they're aspirin. Hey
Mm-hmm.
doc, I woke up, I had a crook in my neck.
Right.
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 Hey, I slept awkward. The dog was in bed with me. I had a
Mm-hmm.
pillow fight with my spouse, right? Whatever the case may be.
Right.
Hey, you'd be surprised the stuff I hear, right?
I wouldn't.
Right. Right. So that's more or less as palliative care, meaning, hey, just kind of take down this ache, pain. I'll come
Mhm.
back, call you again in 6 months if I get a little irritated.
Right.
Fine. Right. And then I have another set of patients, which I call more of a wellness patient. That's a patient where they've gotten out of that acute state and then they start to get maybe some side benefits. For
Mhm.
example, I've had patients tell me things like, hey, I can taste foods better. I've had people tell me, hey, colors look brighter, right?
Mhm.
Or hey, I just feel more energetic. I feel more functional. Then
Right.
those type of patients may come in once a month, once every couple of months, just kind of as a tune up to keep things in place,
Right.
right? So I try to explain to people there's really three things or three reasons why people go to a chiropractor.
Mhm.
All right. Number one is an injury. We all know what those are:
Right.
slips and falls, right? Things like that.
Right.
The second is stress.
Mhm.
What people don't realize is stress, just like in your book you had, Better Black Health, it talks about how stress is killing us,
Mhm.
right?
Right.
We're not meant to be in an acute state all the time.
Mhm.
Now, yeah, 1,000 years ago, when we're running from a saber-toothed tiger, right?
Right. Right.
You want to be in that stressful state, but
Right.
all day, every day, is actually breaking down our body chemistry.
Mhm.
It's causing different hormones to react in different ways, neurotransmitters not to do what they're supposed to do. But then on a lesser physiological level, it makes the muscles get tense and tight,
Mhm.
right? So if a person's in a stressful state all the time, their muscles are tense, it misaligns the bone. That bone then pinches the nerve.
Right.
So that's the second way, right? Another stress is when people have excessive chemicals, whether it be drugs, alcohol, right? Fast food all the time.
Mhm.
That alters the way that your body chemistry functions. That
Mhm.
causes muscles to get tight and they misalign. And
Right.
the third way that people, or the third reason people come in to see chiropractors is poor posture,
Mhm.
right? This social media age, right? We have the one thing we call a text neck. Everyone's head is always down and forward, right? Everyone's
There's
head is
a thing
forward.
called text neck.
Text neck,
Oh my
right?
God, I've never heard of that. I
Yeah.
can
And
see
so
it's a thing for sure. And then they're slumped over, their back is
yeah.
curved, and their
I'm
neck
sure
is
you
down.
I'm sure you remember when your kids were younger, the whole big thing was the video games, right? Hey,
Right.
don't be on those video games all the time,
Right.
right? But
Yeah.
now we call it text neck. Man, you'd be surprised how many young kids they're walking around with these humps on their back, and it's literally as if their head is falling off their shoulders.
Right.
And what people don't realize is when you look at someone from the side, there's always a curve in the neck.
Mhm.
But when your head starts to shift forward, it's like taking a guitar and you're tightening the strings. It causes your entire spine to essentially get tense and
Elongate.
tight,
Yeah.
right? And it's
Yeah.
elongating, right?
Right.
And all that tension over time misalign the bones, pinch the nerves. So, in short, the three things that cause patients to come to chiropractors are injuries, stress, and also poor posture.
Wow, that's crazy. And so one of the reasons why you call it like a chiropractic healing is it you address, just like you just did, you address all the issues. It's not just about malalignment, but having them understand about the inflammation and whatnot. I have this thing where I grind my teeth. And
Mhm.
I find myself doing it, and it's usually when I'm multitasking, and I'm
Yeah,
like, I mean, which is stressful, and I tell myself, stop grinding your teeth, stop grinding your teeth. But then there's other people who they're tightened in their back, or they're tight in their neck, or they're and that chronically can throw things off. Isn't that right?
absolutely. How many times do you hear people say, "Oh, I hold my stress in my shoulders"?
Right, right,
You hear
right,
that all the time, but really it's not you holding your stress in your shoulders. What it is you're probably on the computer all the time,
right.
right? And that's putting stress in the shoulders. Now you have an area that's already compromised. It's misaligning and it's causing more aches and pains.
So tell me about, like, someone comes in, you get a history like we've already talked about, and then what do you do sort of once you kind of put your hands on them? I mean, in a way that we could explain. what are you feeling for? What are you doing when you do that?
Yeah. So very good question. Because if you do a YouTube search,
Uh-huh.
there's things that cringe that make my stomach cringe when I see it. Right? I'm like, oh, what is that? Right?
Right.
It's like a while ago I know a guy told me he had to leave his accountant and go to another accountant because the new accountant told him, said, hey, listen, after looking at your taxes, it looked like a monkey did this. Right? They said I can teach anybody to just hit a computer or hit a calculator. Right? So same token, you can show anybody how to move a bone.
Right.
But in short, to answer your question, when a patient comes into our office, there's a couple of things we do. So
Mm,
first of all, we have them lay face down. Once we've done an exam. So an exam, let me back up a little bit, would be just like you would, Doc, right? We may change some range of motion. We'll do some orthopedic tests, right?
mm,
We're ruling in and ruling out things, right?
right.
It could be a whole slew of things.
Mhm.
And I'm not one of these doctors that get offended when a patient comes in and say, hey, I think I got that. I say, great. We just narrowed down from 10,000 things, right? Now
Right,
we're down to 100, right?
right.
So great, you helped me out, right? So, but when a person comes in, first thing first after paperwork, right? We're going to check range of motion. We're going to do some muscle testing, and then also, we're going to check their reflexes. We're going to
Mhm,
do some orthopedic testing. Now,
mhm,
from the chiropractic perspective, what we're going to do is one, we're going to check that pain area. So
mhm,
I'm going to palpate the area where you say it's painful at. So it could be your neck, for example, or your low back,
mhm,
your big toe. So let's palpate it and see what's going on. Okay.
right,
Then from there, I'm going to check the spine for an alignment perspective to see, is the spine actually aligned
mhm,
one vertebrae on top of the other?
right,
From there, I'm going to check the actual range of motion. Just very subtly, I'm going to check to see, hey, is the vertebrae or the spinal bone moving like the one above it? Is the one below moving like the one above? Okay. Then once we do that, we're going to check tissue changes around the area. Is there any edema, any swelling? Is there any spasms, any rigidity?
mhm,
Things like that. And
right,
then based off that, then we're going to come up with a plan. Hey, are we going to first start them with a little electric stimulation to turn down the pain signals,
mhm,
maybe a little heat to relax the muscles, let them stay there for about 10 minutes. And then we come over, and then that's when the magic happens. Then
right.
we either take our instruments or we take our hands, and very gently we go click by click, and we put the bones essentially back into a realigned position.
Alignment. And that's important because people don't realize that you could have a pain in your thigh or your calf, but the problem is originating in your spine. And because if you imagine with the image, the pictures they show, someone, a skeleton with its spine coming down, those nerves all branch out and go different places in your body. And so spending some time looking at the spine and the spinal alignment can actually fix something that you wouldn't think would be related to your back. Isn't that right?
Yeah, so let me give you a true example. Gentleman, past athlete, right? Knee issues.
Mm-hmm.
Was treated chiropractically, never touched the guy's knee pain went away, right?
Mhm,
And what I try to explain to patients is that we know this innately, but
mhm,
we don't really think about it.
mhm,
And what I tell people is that the most important organ in your body is the brain,
mhm.
right? You
Right,
never heard of anybody saying they had a full brain transplant, right?
right, right,
and it's and it's encased inside this nice skull,
right.
right?
Mhm,
So you can see mine's a little bit better with this body, but but I tell people your brain is the most important organ in the body.
mhm,
The brain communicates and gets information from all the different areas of the body from your environment. Well, how does the brain, for example, send a signal out to your heart? It has to go down what I call the electrical highway. It
mhm,
has to go down your spinal cord, branch out through the nerves, like you said, and then send the signal out to the heart. The heart sends a signal back, and it goes back up to the brain.
right.
And what I try to explain to patients, and we have a lot of different diagrams and a lot of models in the office, is that around the spinal cord is a spinal column because a lot of people think their backbone is one solid bone.
Mhm,
And I like to explain, think of like a building block of 24 blocks from the top of your head all the way down to your tailbone. And that's the spinal column. There's 24 bones.
mhm,
Now, the brain has to send a signal from the brain down the spinal column out to certain parts of the body. If there is a misalignment, and if it's misaligned severe enough, then there's almost like a traffic jam on the freeway.
mhm,
Yeah, you may get to your destination, but you may be late.
right.
Same thing can happen in the position of this gentleman who was having a knee problem.
Mhm,
Yeah, he tweaked his knee, but for whatever reason, because of all the misalignments, his brain wasn't objectively communicating with the knee effectively.
right.
As a result, he's doing things not realizing, hey, this area is tweaked or I need to dial this back because his brain essentially his righting reflex is essentially off. He doesn't really know where he is in space. By simply realigning things like the pelvis, the lower back, the mid back, the brain then is able to send those signals down more effectively. As a result, the body was able to heal itself.
Wow, I mean, that's amazing. And I think of that when patients come to me and say their knee hurts and it's not swollen, it's
Mhm.
not warm, it's not the range of motion's there. And I'm like, what is going on? What is going on with this? And so even I forget, that if obviously if your knee is hot and red and swollen, then it's not your spinal cord, right? But but if your knee hurts and it's not hot and red and swollen, it might be, right? And that's maybe something you need to think about. Tell me about this. And I hear this all the time, and I have to explain it. People say, "Well, I had pain on my right elbow, and then it moved to my knee, then it moved to my right ankle, then it moved to what? What do you think of when you hear about people whose pain is moving?"
Yeah, so that's a very good question. I'm gonna take one out of your book.
All
If
right,
it's the first half of their life, from 0 to 40, and there's a lot of things going on, it's
right,
usually one thing.
right,
If they're in the second half after 40, you got a lot of stuff going on. It's probably a lot of things going on.
right. I'm glad I have an impact on you, but you're right.
but to answer your question on that's a very good question. I simply tell people your body is dynamic, right?
Mhm,
Your body is allowed to change. It's allowed to switch positions and change.
mhm,
I think when someone comes in and say, "Hey doc, my pain started on the left side, then it went to the right side. Now my big toe, now my
mhm.
nose is itching," right?
Right, right.
From a chiropractic perspective, I think that for whatever reason, their body right now is in a hypersensitive state. Their
Oh,
sympathetic nervous system is really flared up. And from that position, I'm going to do as least as possible. So you
mhm,
see a lot of YouTube videos and people are click, click, crack, crack, right? In our office, we move 3 to 4 bones per visit from a manual perspective. Right
mhm,
now, we're using an instrument. We may do a few more, but when we're manually, you're hearing those cavitations, those click like you're clicking your knuckles in your joint. We're
mhm,
moving 3, maybe 4. If someone is really hypersensitive or in a sympathetic state like that, we're going to try to get the biggest bang for the buck.
mhm,
So from that position, then I'm going to be looking at what are some hot buttons, right? So for me, one of the really big ones is your atlas, the very first bone in the top of the neck.
mhm.
Just like the Greek god Atlas who holds the world on his shoulders,
Right, right,
right? That atlas bone holds your world, which is your brain on top of your shoulders.
right.
If that atlas bone, and research has shown, if that atlas bone is misaligned enough, it can cause a whole slew of symptoms. Like
Mhm.
you remember Christopher Reeves who played Superman?
Yeah, right, right.
Remember, he was paralyzed,
Great.
right? It wasn't his knees and his pelvis. He actually fractured the first 2 bones. He fractured the atlas and the second one, the axis. And what
Mhm,
happened is the brain wasn't able to communicate through that electrical highway. And
mhm.
as a result, he started to lose function over time.
Right,
So when
right.
a person is really, really sympathetic like that, then I'm going back to basic physiology, neurology to say, okay, we need to turn down the sympathetic nervous system. So
Right.
we're going to stay out of the parasympathetics, and
Mhm.
we're going to. I know I'm getting really technical, but
Yeah.
we're gonna hit a couple of hot spots that we think may be able to essentially turn down or turn off these symptoms.
Do you find that people have that they tend to be skeptical if they're skeptical of what could potentially be a healing session that interferes with their ability to heal?
Okay, can you ask that a different way?
Yeah, I mean, like I have people I prescribe something and they're thinking this isn't going to work. You know what I mean? I think of my grandmother. Well, it won't. Well, that with that attitude, you know what I mean. So how important is their expectation of the heal? Like someone never my knee hurts and you're going to work on my back. That ain't going to work. But why? You know what I'm saying? So how much is what the patient conceive their preconceptions and their expectations influence their outcomes?
Well, I think 100%. There was actually a really cool study that came out years ago where people that needed knee surgery,
Mm-hmm.
and they did knee surgery, in a certain number of the participants. The other participants, they just knocked them out. They
Mm-hmm.
didn't do any surgery on them.
Right.
However, they thought they got the surgery,
Right,
right? So they
dirty
dressed them,
dog.
they did all
Yeah,
the
right.
stuff,
Yeah.
right? And it was phenomenal how a percentage of the ones who didn't even have the surgery started to receive healing benefits, right?
Mm,
So psychologically, we can psych ourselves out, right?
right,
Or we can psych ourselves up.
right.
So I always tell people at the end of the day, you need to find a healthcare team that resonates with you,
Mm,
right? That's the first step. And, I'm not here to convince anyone of what I can and cannot do. We're about 100% referral. So we don't do marketing or any of that, right?
mm,
We're about 100% referral by the grace of God. But
mm.
I think that the belief system is the biggest factor, because if you don't believe it's going to work, it ain't going to work.
It ain't gonna work. And then this is Better Black Health, so that we've got a Black audience, and Black people are disproportionately pessimistic about their outcomes, aren't they?
Right. I mean, well, rightfully so, right? We know we've gotten the bad end of the stick, right?
Mm,
From, enslavement and oppression, even until today, with a lot of passive aggressiveness that happens, right,
mm,
on the job and in the workforce and things like that. So
right,
I get it, but
right,
I think what we have to do is we got to start loving each other more,
right,
right?
right.
It was so sad. Many years ago, this is I've been doing this now almost 20 years,
Mm,
and my wife, I think this is going on maybe her 15th or 16th year, but it was pretty sad. It was a couple years after she had got out of chiropractic college, and there was someone that looks just like me or you, right?
mm,
And she went into a clinic, and my wife was the director of this one clinic. They had maybe 5 different clinics across the city, and so black woman goes in and you know did a good job, staff, everything was good. Do you know this lady end up getting in touch with the owners of the company,
mm,
and her question was, is the doctor I saw a real doctor?
mm.
Now, not is she a medical doctor, chiropractor, DO, not that.
Right,
Is
right,
she a licensed doctor?
right, right,
And they said, well, yes, ma'am, we wouldn't have people on staff that's not licensed, board certified, right?
right.
And it was just the unfortunately the mindset that because it was someone black, it had to
Mm.
be second guessed.
Oh, right, right, right. Well, I mean, that that still happens, unfortunately.
Yeah. So when you say with us with Better Black Health, I was
Right,
saying we got to do a better job. And I'm not saying, hey, you got to go to someone that's shoddy, that's going to do terrible work, right?
right, 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 right.
Right. Do your research, but we got to start trusting us a little bit more,
More, I
because
think.
we give everyone else a pass.
Right.
And for us, we got to work 10 times as hard just to prove ourselves to each other.
There's extra scrutiny, yeah, and I get that too. I mean, we got on the for the genetic sequence multivitamins. We had a woman to give us like a 2 because the pills were hard to swallow. You know what I mean? And so it's on Amazon. You got it too. The pills are huge and they're too hard to swallow. And so forget that no one's ever designed a multivitamin made for African American women, and that you
Yeah.
get a full refund. Even though she said to try, we give everyone 100% refund. If you get lost, you can game us forever. You know what I'm saying?
Yeah.
Aside from all that, we get a 2. You know what I mean? And it's like
And that's
I'm like, really, don't I get credit for anything? I mean, you couldn't swallow it. You know what I mean? You know what
oh
I mean?
man. Doc, I've never heard that one before. I've
No,
never
well,
heard
it's
that
on
one.
Amazon. Go check that out. You know what I mean?
Oh man.
But
Well,
that's
listen.
us being hard on us. You know
Well,
what I mean?
listen.
But she
Me,
wouldn't
me and
give
my
one a
family.
day. She wouldn't give one a day a 2.
Well, listen. Me and my family, we love it. We're going to continue taking it, and it helps boost us and keep us where we need to be. The only thing, like with my dad, he won't take supplements at nighttime
Uh,
because he's up all day because all it's packed full of good nutrients and vitamins.
well, that's great. And we gave you a book for your waiting room, a Better
Yes.
Black Health book to put in your waiting room. And what have you seen and what have you heard?
Oh my goodness. Well, first of all, the aesthetics is absolutely phenomenal.
Mm,
Absolutely phenomenal. The illustrations, top tier, 5 star. The writing is world class, and
oh,
I can't say anything but good things about it. And I think that it is ahead of its time.
mm,
But when it finally peaks,
mm.
I think that you guys aren't going to be able to keep them on the shelves.
Oh, well, that's really. Listen, I really appreciate that. I think so too. And I usually tend to be hard on myself, but I really wanted that to turn out the way it turned out, and I really appreciate it. So, Dr. Byron G. Jackson. So now, if someone want to follow you on social media, I love your energy. So I think part of your success as a chiropractor is, again, that interpersonal connection, right? That energy. You have the feel of a coach. You know what I mean? So it's not like you're just going to lie my back, but you're going to get my mind right on the way to doing that, right?
Amen. Well, listen, the funny thing is, there are people that we have that have never been patients of ours that refer people to us because we act in a co-management perspective in our office. So there's sometimes patients may come in for a consult or call, and I'm like, hey, I would love to see you, but I'm not the place you need to be. I need to send you to pain management, or I need to send you to one of the orthos that I like, or a podiatrist, right? We love you. We'll pray for you. And there's been so many patients that have literally referred other patients just because they were thankful that we were able to quarterback them to the right place that they needed to go.
Right. That's outstanding. So in social media, where can we find you anywhere? Or
yeah, so I'm not a social media advocate, right? I don't think it's the devil or anything like that.
Yeah, but you're not on Instagram or anything like that.
No, sir. It's just I just don't have the timing for it.
Well, that's all right. But guess what? You're gonna be on Facebook and you're gonna be on.
There we go. I think the office has
we talked about this too late in the program because you are going to be on. You're going to see yourself. When did I do that? But listen, Dr. Byron G. Jackson from A Chiropractic Healing in Northeast Ohio, a great place. Reach out for them. What's your telephone number, at least on the website?
Very good, very good. Now, I do believe that the office has a Facebook page. I'm not involved in it at all, but I do believe the office has a Facebook page, some reviews and things like that up there. But our phone number in the office is 440-442-3000. Again, that's 440-442-3000. And it's A, like the letter A, chiropractic healing.com. And we're located in Mayfield Heights, Ohio, right next to Executive Caterers.
All right. Executive Caterers, Lander Haven, right? It used to be
right next door. Right? Yeah.
Appreciate it. Well, listen, thanks so much. I appreciate you coming on.
Well, many blessings to you, Doc, and thanks for having me.
None of the statements that I have made have been evaluated by the Food and Drug Administration. Genetic sequence multivitamins are not intended to treat, cure, or prevent any diseases. Furthermore, none of my statements should be construed as dispensing medical advice or making claims regarding the cure or prevention of diseases. You should consult your own licensed healthcare provider before starting any supplement, diet change, or exercise program, especially if you're pregnant or have pre-existing injuries or medical conditions. Remember, having a doctor is always your best option.